I want to take you to a nice little medical office in a nice little suburb of Atlanta, where some cosmetic surgery patients who went in for simple procedures are now reporting nightmare results. And what may be even more remarkable about this story is that the patients are seeing concrete evidence of what's been going on in the OR of a woman who claims she's a surgeon to the stars, like dancing and rapping and poking and prodding and cutting to the music. And if you think this is some secret video smuggled out of the OR to sink this doctor's reputation and career, you're going to want to think again. Because a lawyer for several of the patients says this was actually posted by the doctor on YouTube.
Booty's on fleek, waistline snap, got a banging body and a smile to match. Yeah, booty's on fleek, waistline snap.
Well, that is certainly nothing like the mild-mannered surgeon that Dr. Windell Boutte's patients Googled and watched, giving a professional assessment of her practice.
Hi, I'm Dr. Windell Boutte, Medical Director of Premier Dermatology and Surgery and creator of Premier Aesthetic Center. We are so happy that you have entrusted the care of your skin to us. And we want you to be aware that we do offer many aesthetic procedures that can not only enhance the way your skin feels on the outside and looks on the outside, but how you actually feel about yourself on the inside.
Well, here's how some patients feel on the inside. And, in fact, on the outside. The son of one patient says his mom went in just a few weeks before her wedding for a simple procedure, but ended up with lifelong brain damage. Dr. Boutte says she's a board-certified dermatologist, but she's been served with at least 6 different lawsuits, and she has settled several more. Joining me now, freelance investigative reporter Tina Douglas, also Susan Witt, an attorney for some of Dr. Boutte's patients. Ojay Liburd, he claims that Dr. Boutte caused his mom's brain damage. Plastic surgeon Dr. Barry Weintraub and defense attorney Darren Kavanoki. Thank you all for being with me. Tina, let me just begin with you. Has Dr. Boutte answered the most glaring question here, and that is, why are there apparently videos of her dancing and rap singing with the knife while cutting in the OR?
Well, of course, she's been advised not to really speak about her practice or these malpractice suits by her attorneys. I think part of this video and rapping and singing and putting these on YouTube is to try to promote her business. That is kind of the ongoing thing these days. Several other plastic surgeons have maybe not quite the content of her videos, but some flamboyant-like videos to try and sell their practice.
I'm sorry, so this is supposed to make me feel like I want to be that person on the table? Is that what you're suggesting by the explanation?
Well, sort of. We're in kind of the social media atmosphere most of the time, and people go online and they're looking for different things that are going to catch their attention. And so this may be her way of trying to attract business and to sell what she's doing.
Okay, I have more questions for you, Tina. I don't want you to go away, but I need a doctor to react to this. And Dr. Weintraub, as a plastic surgeon, how do you react to seeing this, especially if what Tina just said is true? This is supposed to be helpful to marketing to patients.
I must tell you, it's very upsetting. I did my training here at Cornell in New York City, and the one thing I learned early on was that it's a high honor and a privilege to take care of a patient and to touch a patient, to touch another human.
And to get the trust.
And to feel that trust, and particularly in the operating room, behavior should never be cavalier. This is a very serious place. This is a place where everything has to go according to plan, with organization and backup and proper anesthesia
And by the way,
nursing
look at
and
the
sterility.
pictures. It's not just the physician, it's the assistants as well. All seem to be choreographed as part of it.
From where I've come from, at New York Hospital Cornell Medical Center, I find it hard to watch. I don't even like the phrase selling one's practice. You practice medicine to help people and to act with the highest of conduct.
Okay, there are a few other things that are curious that struck me when I looked at what Dr. Boutte offers. She is, as she says, a board-certified dermatologist. But I want to just go over some of the services that she tells patients she can provide for them, because some of them stand out to me as being very incongruous, say, with a dermatologist. Look at the items in yellow: Brazilian butt lift, breast augmentation, breast lift, buttock augmentation, eyelid surgery, face lift. Again, this is a, you know, she has on her bio, she is a board-certified dermatologist. But the list goes on to suggest hormone replacement therapy, liposuction, a mini tummy tuck, weight loss and wellness, phentermine, which is it's a drug you can take. It's a prescription, and it helps to, you know, curb your appetite. Natural weight loss management, nutrition counseling. All of these seem like they shouldn't be coming from a dermatologist, but Dr. Weintraub, am I wrong? Is that normal for your profession?
It's not normal at all, especially the first set of yellow lettered items. Those are specific surgical procedures. It seems that this individual was trained in medical school and went on to do a dermatology residency. And we all know that dermatology refers to the skin and its surface. Surgical procedures like butt lift or breast augmentation or
Tummy tucks
rhinoplasty
and all
and tummy
that.
tucks are
Liposuction.
much, much deeper,
Yeah.
involving deep elements of the human body, and have to be under the best of conditions of sterility, staffing, backup, emergency care. We are inspected every 6 months and formally every 3 years in our facility to make sure all of that relates to safety for our patients who undergo these procedures.
So Susan Witt, you are representing several patients of Dr. Boutte, and you have indicated to us that these videos that we are watching came from her own postings on YouTube. And I don't know why anybody would post anything like that. As a journalist, I wouldn't necessarily post something like this. And my practice it's not life or death. But I do want to just stop and let people listen unadulterated to some of the things that she's singing, because even the lyrics stand out in this next clip. And honest to God, I can't make this stuff up. But this is a song that is by it's a popular rap song by an artist named O.T. Genesis called Cut It. Have a look at this.
Cut it! No. You need to cut it!
Cut it, cut it, cut it, cut it, cut it. Them bitches way too high, you need to cut it. Cut it. Your price is way too high, you
I'm about to cut it!
cut it, cut it, cut it, cut it, cut it, cut it, cut it. Them bitches way too
So,
high.
Susan, I'd like to ask you your reaction to those videos, especially since you're representing patients who claim they have been irreparably damaged in her OR.
Thank you. Yes, we were shocked when we discovered those videos. It was very concerning to us that she did not appear to be taking these procedures that seriously. We were concerned about the sterility of the environment, that infection protocols were not being followed. Just the overall atmosphere in her operating room, and I'm going to use that term loosely because these procedures did not take place in a actual operating room or a hospital or an ambulatory surgical center. These procedures are taking place in her office in a room which she has built out as a, I guess, somewhat of an operating room, but certainly not what you would expect in a normal surgical setting.
And I want to make sure that our audience understands we've had to digitize part of the image because we feel it's shameful to the patient who's on the table. The physician is actually shaking the person's flesh and literally cutting while singing. So it's not sort of a pre-op while the patient is being sedated. This is actually happening during the performance of the song. And this isn't the only video that there is. There are several different song and dance routines going on. Talk to me a little bit, though, Susan, about why, because the layperson in me says, well, certainly that doctor won't be, practicing now. That's not the case, right?
No, that's not the case at all, which is why my clients have voluntarily stepped forward to tell their stories because we are frustrated that the Georgia Composite Medical Board has failed to take any action against this doctor. Now, this doctor is just one example of many who in Georgia need to have some regulation on their license because these physicians are practicing well outside the scope of what they're trained and what their education entails. So it is concerning to us that the Composite Medical Board has been aware of Dr. Boutte since March of 2016. Ojay's mother was catastrophically injured in February of 2016.
And I want to get to that. Actually, Susan, I want to get to Ojay's mother's story, but not before I hear a little bit more about the presentation of this particular doctor to her patients. Her own website and her bio that is posted says that she's board certified in surgery and dermatology, okay? But we actually looked up the medical records. And while she claims that she is certified in surgery and dermatology, the state medical records actually list her as board certified in dermatology. Susan, is that something that is a legal issue, or is that just marketing?
Well, no, that is a legal issue in terms of the misrepresentation of your qualifications to the public who are relying about what you're putting out there in terms of your qualifications and if they're going to select you to do these important procedures. There's no dispute that Dr. Boutte is board certified in dermatology. She is not board certified in surgery. That is a separate board certification by the American Board of Medical Specialties, and she has not gained that level of certification.
Okay, she's also facing 6 lawsuits to our knowledge right now. She has 4 malpractice settlements that we've been able to unearth at least, and I'm just going to go over them very quickly because they're not small. In February of this year, $1 million settlement. Also in February, nearly $1 million. In January, the month before, $95,000, and just last October, another close to $1 million settlement. Now, it is not unusual for doctors to be sued. They carry malpractice insurance for a reason, and they settle as well. So that's, on its surface, not necessarily a talking point. But I do want you to hear this one fairly ironic piece of video that Dr. Boutte posts on her site about you as a patient and what you should expect when you come into the OR. Have a look.
Smart Lipo has totally revolutionized the concept of liposuction. It is a simple procedure that is done in office under local anesthesia with the patient listening to their iPod, singing along with music, and it's actually an enjoyable experience.
An enjoyable experience. Sing along with your iPod. You can be a patient and listen to music, or you can just listen to mine and maybe sing along with me. Oh, you're under anesthetic. These are the claims that are being made against this surgeon. I'm going to ask you all to stay put, if you will, and particularly Ojay, when we come back, I want you to tell me about your mother. She was set to get married in just a couple of weeks. She went in for some Botox. She was convinced that perhaps maybe another procedure might be to her liking. And now you are left with a mother who needs permanent care for the rest of her life. We're going to get that story and find out a little bit more about the law, where it stands, why this physician is still practicing, and whether the American Medical Association has something to say about this. That's next.